Welcome. My name is Josh Sharfstein. I'm the director of the Bloomberg American Health Initiative and the vice dean for public health practice and community engagement here at the School of Public Health. I know we have a webcast audience and we're recording this for the future, but all of you who are watching either in the future or now and the people in this room are in for a great, interesting experience because we have a phenomenal speaker with us, Beth Blauer, and she is with the Centers for Civic Impact at Johns Hopkins University, but Beth and I met when she was, we certainly worked together at the state of Maryland. We might have met before that even. But Beth was responsible for the performance management and measurement of all of the activities of the state of Maryland. She is, in her field, one of the top thinkers about how to measure and improve performance of government, particularly, but beyond. She was telling me recently she just flew back from California where she was speaking to hundreds of judges who brought her there to talk about how they could improve their performance and efficiency. And what you'll find is that a lot of pretty much everything that Beth's talking about is data-driven. And a lot of it overlaps with some of the principles in public health, epidemiology, how data is captured. But then what she does is she uses it in ways that are directly relevant, immediately implementable. And as a result, the kind of work that she's done both at the state and in the private sector where she was before she came to Johns Hopkins is really to have incredible impact in the delivery of services of all kinds. So health is just a part of what she does, but she brings this understanding of the importance of data, the use of data, the packaging of data, and ultimately the way that data can be translated into action. So we're really fortunate to have her. And Beth, I will turn it over to you.
Thanks, Josh. Hello, everyone. I'm going to keep a close eye on the time because I really do want this to be more of a discussion than me lecturing. What Josh failed to mention is that I was on the red eye this morning, flying back from that conference in California. So I'm a little road worn and weary, but I'm really excited to be with you and really happy to be addressing you. I'm going to talk today a little bit about my background, just to give you a little bit of context sort of about my professional growth, because I think that as you're thinking about your own careers and sort of the next steps for yourselves, I always like to kind of bring in sort of how I ended up from being a person who graduated from the University of Maryland with a women's studies degree to now being sort of in this field, thinking about data and evidence in real ways. I'm going to talk about kind of the emergence of performance stat, the work that we did together, both at the city and at the state level. And then I'm going to talk a little bit about the work I do now with Bloomberg Philanthropies across the United States in their American Cities Initiative, and then talk very broadly about kind of where the future of the field is going and some of the work we're doing at Civic Impact. But again, I would love for this to be more conversational. So if you've got questions, feel free to raise them, but I'll also reserve some time towards the end for us to hit some questions. So I use this picture of this person. Does anyone know who this character is? It's a fictional character, but this is a character from my least favorite television show, The Wire, who was the person sort of depicted in a role that I took on. And I feel like we are sort of opposites of each other, both how he's depicted. But my very first job, and I'll tell you a little bit about my first job in government. I am, like I said, I graduated from the University of Maryland with a degree in women's studies. But I went to law school, and I graduated from law school thinking as I went into law school that I was going to come out and be a public defender and work in the public defender service, but also facing a mountain of debt and realizing that I wasn't going to be able to make a dent in that debt as a public servant. I decided to go and work on Wall Street. And so on September 11th, I was working at a hedge fund doing SEC compliance, and I lost my job. I worked in the World Trade Center complex, and I lost my job, and I sort of had this sort of crisis of consciousness in that moment. And I thought, I'm doing a job that's soulless and I hate, and it wasn't why I went to law school, and this, for me, was a real signal that I needed to make a change. And so I decided to move home to Maryland, where I was from. I wanted to live in a city So I grew up in suburban Washington, D.C., and I knew I did not want to be in D.C., so I moved to Baltimore, and I got a job as a juvenile probation officer, thinking it'll get me into court, I'll be able to sort of learn where I wanted to be, I'll meet judges, I'll meet the bench, I'll figure out where I want to be, and I'll also understand a little bit of this sort of system dynamic that I was entering into. And so I took this job as a juvenile probation officer. And the first thing that you have to do as a juvenile probation officer at the time in the state of Maryland was go to a 6-week residential training program, where I had to bunk in at Camp Frederick, which is like way out in Baltimore County, where all of the incoming correctional officers, probation officers, police officers, they all went for this residential training. And I was there at the residential training, and I learned 2 important things. The first thing was I was entering a class of public servants of highly motivated, incredibly competent, smart, and very public service driven people. All the things I didn't expect, right? I had sort of been brought up with the notion that, the public sector was inefficient, that they weren't delivering high value or quality. And what I found in that entering class was that there was so much energy and so much drive for people to give and to put into the public sector that I didn't expect. The other thing that I learned was that there were lots of standards within state government that were sort of regulating the way that you onboard people, that you learn skills, that you think about skills, that felt a bit antiquated and a little bit disconnected from the realities of the work that we were going to have to be doing on a regular basis. And it was my first sort of realization that I was going to be able to make these observations in the work. And so I started work. I was put in a unit where I was essentially on a 24/7 on-call unit. And so when children were arrested for very serious crimes, they would call an intake worker, and you'd have to meet them either at the district or at the processing center here on Gay Street to figure out whether or not the child was okay to go home with a guardian, or whether or not the child should stay in detention overnight, waiting an interaction with the judge. And I had to make that decision with very little information. The only information that I had was a police report that was written by a police officer who was an arresting officer, and then any criminal background information that was within the systems that juvenile services had. And the reality of the situation was I didn't know whether that child had been in school that day. I didn't know whether or not there was a social worker involved in the life of that child. I didn't know whether or not that child was taking advantage of any of the sort of critical services that the state provided, that clearly I could have had access to that information had the systems been more interoperative. I really had very little information. And at that moment, I started to be a real advocate for the fact that I was not being equipped with the right information and data to make those decisions. And it was producing really bad outcomes for the children that were in our care systematically. And so I immediately became a squeaky wheel. I started to really call out my supervisors and the people that were supporting us in our work, saying, like, this isn't right. I need more information. I need better information to be able to do this work. And I don't know if this is like the same in some of the careers that you've pursued in your own work, but the squeaky wheel doesn't get fired necessarily in government, but oftentimes will get promoted further and further away from the front line because they're really trying to stop that sort of disruptive thinking from the front line of the organization. And so I slowly started getting pushed up into leadership positions in the Department of Juvenile Services. And when Martin O'Malley was elected governor of the state of Maryland, I was the chief of staff for the agency, working in the secretary's office. And I had been working on a few different data-driven initiatives. One funded by the Casey Foundation called the Juvenile Detention Alternatives Initiative, which was a data-driven approach to trying to reduce the amount of children who are entering into the deepest ends of the juvenile system to expedite case processing time. And so I started to get a little bit exposure to the value of using data on a regular basis to support better decision-making and how systems thinking with the leverage of that data work could be possible. But I had the opportunity shortly after the election to go and sit in on some city staff meetings, and they were absolutely transformational for me. I went across the street to City Hall. I had been working in downtown Baltimore, and I went to City Hall, and I sat in on a public works city stat session. I sat in the back. I got a special invitation for someone who worked in City Hall who was part of our transition team. And I immediately was sort of like very taken with the fact that the mayor of the city was talking to people that were responsible for leading agencies. They were using data and evidence as sort of the backdrop of that conversation. They were talking about real implementation challenges to delivery, and no one was in trouble. No one was actually there to be held accountable in the way that I sort of thought about interactions with chief executives. But these were productive conversations that were built around data that were really designed to actually move things forward and to take things to the next level. And I absolutely had two mixed emotions. The first one was pure excitement that government can work. It can function in a way that actually delivers results. But secondly, I was terrified. I was totally scared to death because I knew that we were going to, as a state, really struggle engaging in this type of governance because we were not engineered to do this. We were not set up to do it. And it was very terrifying. And I was like, I better dust off my resume because I'm not going to last long in this environment because I was really, really had a lot of anxiety about the work itself. Just to give you a little bit of a sense of where Baltimore was at this moment in time. So this is a data visualization that actually O'Malley uses a lot when he talks about this work. The far map, which has the denser red marks, was sort of what Baltimore looked like. This data is representative of homicides and non-fatal shootings at the beginning of the O'Malley administration. So one of the main focuses of this data-driven work that was happening at the city level was targeted to violence reduction. But this map, we've taken the same map with the same time periods, and you can overlay a lot of the social determinants that we know the city struggles with, and they overlay almost directly in the same scope and in the same geographic distribution as the data that you see here. And the reality of the situation was that CityStat was credited for really bringing a focus to the systems change that was required to reduce this map, which was the far right, to where it was when I was taking, when O'Malley was taking the helm of governor in the middle map. You can see that this sort of persistent attention to the information and the data, but also those conversations around the reductions of violence that led to and yielded to the improvements were there. But the work was still certainly cut out for us. So how did the process work? So we, sorry, there was a little animation there I didn't expect. So, and if it comes back again, we're just gonna go with it. But it was very basic. I was really actually impressed with how basic it was when we first started doing this work. But when the analysts first came to our agency, the Department of Juvenile Services, they came to us and they said, we don't want you to produce any new data. We want you to use data that already exists in your systems. And one of the things that we learned very early on was that we really did own a lot of data. And then they said to us, we want to also know, what are your key objectives? What are the things that you want to accomplish over the next 2 and 4 years? What are your goals, your aspirations? And they really carefully talked to different people across our organization to understand what we were trying to achieve, what those objectives were. At the same time, the administration had their own perception of what we should be doing. They had their ability to, they had the ability to see from sort of a bird's eye view, organizationally, from an enterprise level, what they wanted to accomplish. And one of the most useful exercises that we went through was sort of a weaving together of the work that we were trying to accomplish, the things that we knew that could make our agency great, with sort of the perception or the things, the focus that the administration or the leadership wanted us to achieve. And this point shouldn't be lost. If you're thinking about embarking in a data-driven approach to your own work, or when you're thinking about creating an outcomes framework for research or for anything that you're doing, the people who are responsible for direct service really need to see themselves reflected in your work. If you take a top-down approach to the way that you shape research, the way that you shape the way that you think about problem solving, and it doesn't make those deep connections to that reality, you often will create what I call fatigue amongst those people that are most responsible for delivering or implementing. And if they don't see themselves reflected, and certainly we saw evidence of this across the board when we were going about doing this work, if you don't capture those actual realities, you then create, essentially, we're going to feed this beast. We're going to create a data structure where we'll just report data. We don't really care about the quality of that data. Let's just tick the box, move it off of our desk, so then we can focus on the actual work. But when people actually see their passion, the reason why they are waking up and coming to those jobs every day in the work, you'll see them engage at a much higher level around the data and around the work itself. And it was one of the pieces of this process that I thought was so important in our work. And we were using Excel. We were using off-the-shelf software that was available on our desktops in these original collections to really think about how we were collecting the data. And we're using sources of data that already existed. But we had the opportunity to get into a room and to have levers of expertise around a table to help us think about the biggest challenges. This is some analysis that I did. So at a certain point, I was responsible for ushering in STAT into the Department of Juvenile Services. And then about 6 months into the administration, the governor asked me if I would come and lead state STAT. So I got to leave the perch of one agency and do this work across the entire system. But I still wanted to focus on the things that mattered most to me. And one of the things that would keep me up at night when I was both working within the Department of Juvenile Services and then moved into this role was this notion that we had children that were in our care and custody, and we were essentially placing them into homes, whether it was foster care homes, temporary shelter, or they were going into different types of facilities. And we also had this other big set of data that we were watching very carefully. And that big set of data was, where were our most dangerous and violent offenders? Where were our registered sex offenders? And all I wanted to do was take the two data sets and mash them together to make sure that we weren't putting kids that were in our care and custody into places where our most dangerous and violent offenders were living. And we weren't mixing those two populations. And the reason why I use this, not only because it yielded a sort of astounding result, but when we went to the social services agencies and said we wanted to do this data exchange, they understood that it was important for us to understand this information, but they had a series of legal hurdles to release that information so that the parole and probation agency could get access to it to do this mix. And one of the most critical assets that I had on my team was someone who I called my yes lawyer, a woman by the name of Cassie Motz, who is one of my most favorite coworkers of all time, would sit next to me, and she was my yes lawyer. I had a whole team of AGs that worked across the state where there were no lawyers, and they were protecting us in really smart ways. But I also needed a yes lawyer who could really understand the dynamics of why we couldn't do certain things. So Cassie and I took this off the table, the legal barrier off the table, and we just started talking about, well, what if we did do this match and it yielded that we were co-locating some of our most vulnerable citizens with some of our most dangerous. And we started to make a plan about what would happen if we actually did this data exchange. And then behind the scenes, Cassie and I started to unpeel the onion of the legal restrictions of doing this information exchange. And it turned out that it wasn't a risk to any of our federal funding if we release the information, that there were no state laws that prohibited us, but there was a regulation that had been put on the books by the state as part of an administrative procedure in one agency that was creating the barrier. And it was something that we could undo. As soon as we understood why it was there, understood whether or not the right protections were in place, we were able to remove the barrier. And sure enough, within a month of the initial conversation, we were able to do this data match. And what it yielded was, in the big orange circles were the concentrations of co-location between the juveniles that were in our care and custody that we were responsible for protecting, that were co-located with people who were on our most dangerous and violent offender list. And then the green triangles represented individuals who were on both of those lists, in our care and custody, but also being identified as the most dangerous and violent offenders in our state. And we were immediately able to deploy an action. So we had the data. We had been working on what would happen if we figured out that there was this co-location going on. And the day that we were able to do the data exchange, we were able to deploy resources into the community where we had safety plans in place, and we were able to make sure that those children were safe, that the outcomes that we were in control of were going to head in the right direction. We removed 35 children in one day and had to replace them into different placements. And we were able to put stabilization plans in nearly 100 other households. So the realization here was that this was an opportunity. This was data that already existed. It was easily accessible. We had all the capacity in government to actually do the exchange, to do the work, but we just needed two key elements. We needed people who could scope the problem, identify it in a way that actually elicited the right kind of intervention. And then we needed someone who could actually do the work of matching the data and making sure that we could do the analysis. And then we needed the subject matter expertise at the program level to understand what was best for those children, what was best for those families, and making sure that when we came in with the intervention, that the intervention was the right intervention and that it was going to yield the right result. And we did it. And we did it not just in this passion project at the Department of Juvenile Services, but we did it in a whole host of other areas. So by the time that we left office, the Chesapeake Bay was nearing a healthy bay tipping point. We had, and Josh can talk at length to the health outcomes that we had a significant impact on. We had extended school feeding programs. So we were not only just getting or maximizing those children that were participating in free and reduced lunch, but we had extended it to evening meals for the first time and summer meals for the first time. We had really driven down violent crime numbers to 1975 lows. We were across the board the number one school system in the country for 4 years in a row. There were lots and lots of outcomes that were credited to the fact that we were using data, we were being smart about defining what those outcomes were, we were being very deliberate, and we were creating these routines to make sure that we were holding ourselves accountable to what was working, we were investing in what was working, and we were divesting in those programs that weren't yielding those returns. But we had a leader who it really meant a lot to, who showed up in the room, who, if wasn't in the room, would see Josh at the ribbon cutting or the event and say, hey, I read the memo from the state stat session, and it turns out that, these efforts are sort of are stalled. Can you help me? And Josh would go back and shake things up and get things moving again. But there was sort of this constant rhythm and expectation that you were focusing on the information, that you had these shared goals and objectives, and that the data was sort of rolling in and producing those outcomes. And so at the end of this, I realized that there was a huge opportunity to sort of spread this work across other public sector organizations. So I left the state of Maryland at the end of the term, or near the end of the term, and I went to work in the private sector, where I was building software tools to go and help governments figure out how they can extract data, reduce the friction of getting the data moving, but then aligning it to outcomes in real ways, and using easy to use off-the-shelf software to do it. And while I was doing that, I had the opportunity to meet Mike Bloomberg. It was a chance opportunity that turned into a sort of career-defining opportunity, because about 5 years ago, he came with his team from Bloomberg Philanthropies to me and said, we're thinking about this American Cities Initiative. We want it to really go and focus on the work that cities are doing. And we want to start at Johns Hopkins University, a center that's really designed to build out this capacity in cities to do this work. And I couldn't think of a better place I wanted to be than Johns Hopkins, in a city that I love, but also doing work that I really care about. And so we launched first the Center for Government Excellence in 2015. And in the first year, we went to 126 cities in the United States. And we essentially surveyed their capacity to use data and evidence and understood kind of what the state of the practice was. And while we were doing that, we identified opportunities to improve their practice. And then we went back and we provided technical assistance to those cities so that they could improve their practices. So whether they were wanting to stand up their own city stat, or whether they had their own performance management approach, or whether they were just getting started and needed an inventory of the data resources that they had so they could understand how they could start aligning data outcomes, we started to do that work. And one of the things, and we also had the opportunity to go abroad and do some of this work, and I'll talk a little bit about some of those examples. But one of the things that we learned very early on in the work itself was that the public sector is poised. They have deep subject matter expertise, sort of hearkening back to that original realization that I had in my 6 weeks of training. Some of the smartest people that I've met in my career work in government. But especially after the 2008 fallout in the economy, one of the biggest impacts that I observed was a kind of systematic divestment in the skills of the public sector. So when I first started, I got to 6 weeks of residential training before I started. One of the first things to get cut in 2008 were those types of training programs. The ability for us to invest in our public sector workforce became obsolete. The funds to do it just weren't there. And so while we were hiring and attracting subject matter experts across our program areas, they didn't have necessarily the sort of competitive skills that are required to do the data work that we now want them to do. And so when we started to go in and do this work, we realized that these benches were very thin. Our data thinkers were very thin. We had subject matter expertise in spades across many programmatic areas, but we didn't have social workers who knew how to build a pivot table to sort of optimize the way that they were doing case distribution. And we didn't have people who were responsible for service quality who really understood how to implement surveys appropriately in a way to actually improve service outcomes. And so one of the things that we agreed to do with the folks at the philanthropies was to build essentially a data academy. So about 18 months ago, we launched the GovX Academy. We've had over 5,000 public sector workers trained in different capacities. We have 4-week Hopkins certification courses that are designed for public sector thinkers in these sort of critical data skills, but they're not designed for IT folks or people who have deep technical expertise. They're designed for those people who are responsible for that delivery. And that's been critically important to our success and our ability to effectuate these change that we're seeing across. And so what are the other kinds of things that we're doing? We're also building up a view of all of the cities that we're doing this work in so that we can start to do some work across those cities from a comparison. So if you're thinking about research of your own or you're thinking about work from the perspective of things that you're interested in, we now have a huge database filled of information related not only to sort of the basic sort of census-driven data that we can extract from cities, but also the specific data that we've been working in our own implementation projects across those cities. And it's become a really valuable asset from the university perspective. We also are doing these rigorous assessments of data practices, and the survey is yielding a lot of good intelligence on where cities and governments are in terms of their ability to actually execute or implement new ideas. And that's been also incredibly important from a research perspective, to be able to actually pair university-led research with a city who has the ability to absorb it in real ways and actually go for scoping to implementation appropriately. And then we're actually getting, for the first time, a real understanding of the challenges. One of the big impediments to some of the data deployment and the work around data that we observe in cities is that cities and in governments have real difficulties scoping the actual problems that they face to elicit the right kinds of solution. And we see this within government and also as government tries to partner with externalities. So within government, I can give you many examples of where I had a very small technical problem and I met with IT people and they would come to me and they would bring these big, massive enterprise-wide systems and say, like, if we can totally do this like $25 million overhaul of the case management system and it's going to solve this very inexpensive problem that I had with just doing reporting out of a system that already existed. And there was a real mismatch. When I went to work in the field developing software, one of the most critical roles was a product manager. I was a subject matter expert and we had engineers, and the rules of engagement were I would never ever be able to talk to an engineer directly. But in government, that doesn't exist, right? We don't have that intermediary who takes my user needs and translates them into actual technical requirements. So what we have are programmatic people who are trying to explain the challenges of delivery, and they're talking directly to sort of the engineer equivalent, and they're getting really mismatched and skewed solutions for problems that probably have much easier solutions. And until you start to actually develop that capacity to be an intermediary, a solutioner within government, you really are challenging yourself and you end up spending a lot of money. And oftentimes you end up having a lot of employee turnover because of the frustration that exists in that sort of loss. what are our mayors and governors thinking about? So we, as part of this survey, look at what are the sort of top of mind issues. And most of our mayors specifically are focused on the spectrum of housing that we sort of define as everything from homelessness to the accessibility of affordable housing as being one of the leading issues that our cities are facing and trying to find solutions for. Behind that, we'll see economic mobility and poverty as some of the biggest issues that our cities are trying to tackle, resilience and sustainability, with public safety and education coming in, which was a real surprise to us. But that is largely because cities don't typically actually own their education system. So they're dependent on either a county structure or a state structure that's responsible for education delivery. But there are inextricable links between education, and economic mobility, and some of the other areas that we are working with cities to tackle. You can see the geographic distribution, so you can see where the economic mobility and poverty issues are really concentrated in sort of the mid-American section of the United States, where our coastal regions are really focused on housing challenges, housing affordability, particularly in the Northwest and the California cities, and then the East Coast is a real blender mix. So I'm going to take you through a few of the projects that we're working on now, just to give you a little taste of kind of how this implementation work is looking in practice. We're doing what I think, we've completed actually a piece of work in Buenos Aires, Argentina. So has anyone ever been or is from Buenos Aires? Okay, so you've been. Been, okay. One of my favorite global cities. I had never gone before this work started. I encourage everyone at some point to go to Buenos Aires. It is a world-class city. But one of the big challenges is that they've got huge swings sort of in economic strata within the city. So they've got the northern part of the city, which is very affluent, very cosmopolitan, and then the southern part of the city, which is really struggling. They have a very, very poor population there, and they really have major hurdles and barriers to many, many things. But one of the things that the mayor of the city wanted to do was to make sure that everyone who lived in any place in the entire city was in with a 15-minute commute, accessible by either public transportation or foot, to their primary healthcare physician. And when we started this work, they wanted to create sort of an equitable access, but also not just primary health, but the right primary health. So if you had populations of women who were of childbearing age, they wanted there to be people that had OBGYN specialties, and they had access to going and seeing specialists that would be appropriate. We had huge populations of those of aging in place adults in the city. They wanted to make sure they had geriatric specialists in the right population. So it wasn't just about having a doctor accessible to you, but they also wanted to make sure that you had the right kinds of resources accessible to you. And in addition, they wanted to measure a whole host of outcomes to see whether or not this effort was actually paying dividends. They wanted to reduce wait times in their ERs. They wanted to reduce an over-reliance on emergency departments to treat things that would be better treated in the community. They wanted also to make sure that a lot of the social determinants of health were having an impact by redistribution of health assets. So we started looking at school attendance. We started looking at a host of different outcome areas to focus on this work. And the first real challenge was trying to figure out what the distribution looked like at the beginning and how the redistribution would look. As you can imagine, most of the health assets were distributed in the northern part of the city. And in the southern part of the city, there were long, protracted commutes to get to access and to care. And so the first round of this was bringing it to the health system and saying there's going to have to be either a redistribution of those health assets or a creation of new health assets in the southern part of the city. The mayor took this actually so seriously that he literally moved City Hall from the northern part of the city to the southern part of the city. They were finishing a big building that was meant to be, I think, a library. And he said, nope, we're going to take City Hall and we're going to physically move everyone who works for the city into this community so that you can see the impact that you're having on the community. And then they started to repurpose buildings across the southern region of the city to create community-based health clinics. And then they started doing the work of mapping out who the population was, learning more about the population, what their needs were, and distributing those health assets. And with the help of using data, thinking about what those goals were, the city is now poised to be able to make good on their promise of every resident living within 15 minutes of the commute. But they're also seeing dramatic rates of under-reliance now on the EDs. Infection rates are going down, a whole host of other indicators that they were tracking to validate this work were coming to fruition. So this is a kind of other end of the spectrum story. This is a city, Memphis, Tennessee. And this is actually about our training. So we have a training where we, again, are teaching people how to use very lightweight analytics. And all of our students are meant to bring their own data to our coursework. So we had a woman from Memphis, Tennessee that worked for the Public Works Agency. And she came to one of our trainings and she said, I have a real issue. Everyone is complaining about our trash pickup. And it's kind of the most referenced complaint that we're getting from citizens is that trash isn't consistently being picked up. Students are having a hard time walking to school because the trash collection is inconsistent. We're having major problems getting traction. And so she brought 311 data, she brought the complaint data, and she brought the contracts for the vendors. And it turned out that she was able, within a 4-week period, to identify that all of the source of all of the complaints and all of the issues the city was facing could be credited to only one of the 5 contractors that was responsible for collecting and handling the waste management of the city of Memphis. And so, with our help, she was able to draft a memo that went both to the sort of the secretary of her department or the department head and the mayor. And she said that I think that if you cancel this one contract and redistribute these routes to those that are actually performing quite well, that we're going to have a huge impact on our ability to turn the tide. And was able to show with data and evidence why the decision would be smart to make. And sure enough, they canceled the contract. And within a month of the cancellation and the redistribution, 311 complaints went down by over 80% for trash pickup. She was able to have, she was actually promoted into a much higher role, right? Which is actually really great news for us, right? We're getting people moving in government. And the city of Memphis is now taking the same approach that she used in the distribution and analysis. And they're looking at all kinds of different service areas and how they can use the same very easy analytics to do service optimization across a whole set of different outcomes. So I preempted myself. Kansas City, Missouri also has been the recipient of technical assistance from the centers. And they are part of our advanced analytics cohort. So they came to us with an issue that they were facing where they had a huge backlog of property violations. And the property violations were everything from abandoned properties to overgrown shrubs that were creating dangerous conditions in a community. And what they were really wanting to do was not to put a further tax on poor people that were living in their city. And what was happening was that the inspections were doing just that. That they realized that their inspections were really targeting people that were very much vulnerable to homelessness. And they wanted to make sure that they weren't creating a punitive structure that were pushing or expediting people from stable housing into homelessness. And so we helped them think about not only how they could use data and analytics to optimize how they were distributing their violation inspections, but also how they could use that same data to predict who was most vulnerable for going from having stable housing to not having stable housing, and how to bring in a set of interventions so that you could do some stabilization in those families so that they could stay in the housing for longer. And so they, again, were using pretty basic analytics skills, but we were able to teach the actual practitioners how to use R and open source resources to look at their data to really drive some of the decision making. We taught them not only how to do that from the perspective of this, but now the idea is that they're taking these skills and spreading it across a whole host of other outcome areas. And they're being much more intelligent and proactive about not only how they're going about this, but how they're allocating internal resources to the work. And they're able to really understand their own data in a way that's having a huge improvement, not only in how they're doing the distribution of their work, but also the sustainability of those families. A couple of other things that we're doing in the centers, we're creating different types of indices. Again, because we have all of this traction with cities and we're getting all these inputs from different cities, we've created a housing affordability index that many cities are using to start thinking about whether or not they need to think of policy tune-ups in their own housing. If they're at risk for really sliding into unaffordability, the index will give them a bit of a heads up. They're also looking at the difference between home ownership and renters and figuring out what does that mean for the landscape and their ability to actually create more long-term and sustainable housing options that are not out of reach for some of their most critically vulnerable populations. We're using the same data essentially to look at shifts in voting trends to see whether or not that's going to have an impact on policies that we're deeply invested in across a whole host of other indicators. And we're doing these types of things because we not only are sort of the rising tide, raising all ships, getting cities to think differently about how they're using data and improving the quality of that data, but also how they can start integrating some of these strategic data resources into their own decision making. So that is all I had from a content perspective, but I was hoping that there would be some questions. So I think we have some time for some questions. Yeah? Yeah. Oh. Thank you. Yes.
Got your experience in this here in Baltimore, Maryland. So what happened to the whole group who started all this in New York?
So what happened to Bill Bratton was the police commissioner in New York City where this all started. And he had a guy by the name of Jack Maple who was kind of his data person. And they were responsible for coming down. And when O'Malley said he wanted to do CompStat, which was the original idea, they came down and there's a sort of fabled story about Bratton and Maple and O'Malley in a car driving around the city, and O'Malley and they're saying, tell us what you want to do for the city. And they were just listing sort of data sets that they could measure. So, they would go around, he's like graffiti removal, and they would, 311, like all of the different things that you could measure and that they're the sort of team that convinced him to do it. Now, the story in New York is not a great story. I mean, a lot of the CompStat story is kind of intertwined with stop and frisk policing, over policing, a lot of over arresting, big bias in the way that they were delivering services. But I think even Bratton had that realization sort of midway through. His last book or most recent book that he published was actually called Collaborate or Perish. I think that the sort of history of CompStat and the sensationalization of CompStat and kind of the way that, there is a lot of sort of fabulization that has happened in people hiding dead bodies in abandoned homes and doing things to try to get those CompStat numbers to look good. That it wasn't as extreme in practice, but it was real, right? There was definitely some gaming in the data, and a lot of it was because the approach that was taken, it was a real harsh accountability approach in the room. And I think everyone in that early phase realized that just wasn't going to fly. And so, and certainly wasn't my style when we were doing this at the state level. And I made it pretty clear. I was like, this isn't about firing this is about results and making sure that we're equipping the public sector with the tools that they need to actually deliver. And one of the emphasis that we brought to the work at the state level was really about the emphasis for me essentially was, and I think the value of the fact that I was a probation officer and I had experienced government from the frontline perspective gave me a little bit of cred in the room so that I could actually keep the work deeply connected to the realities of frontline work. And I think that's where a lot of these systems, when they become very top down and accountability driven, fall short. But Bratton had this realization, went on to be the LAPD commissioner, And the results in New York held. I mean, the thing about it is that New York has been able to sustain through many different types of leadership now, very low crime, huge economic viability. Now, one would argue that their housing market is a mess and that poor people don't have anywhere to live, and they rely on poor people to work, and they're creating a much bigger risk in terms of the health outcomes for people because of the way that the economics have shooken out. But the idea here is that you have to be deliberate about the way that you approach these things. And so a lot of the work that we do is saying, like, we are taking a do no harm approach. So we want you to be focused on outcomes, but that the conversation can't be about trade-offs. It has to be outcomes for all. Yep.
Thanks. It was an interesting talk. Thank you. It was an interesting talk. Can you speak a little bit to operationally how data changes hands, and like with respect to your center, and like, are you building out platforms that cities are using, or like if there's a technological solution that you and your team develop, how do you interface? I mean, what sort of data platforms are the cities using, and how, I mean, say you have an enterprising graduate student that develops some cool new visualization that you think has a lot of added value. How does the intellectual capital that you're generating, sort of, how is that transferred, and where does the data, the raw data, sit that within the cities that you're assisting, and do you see or touch that? And I'm just interested in kind of that that space.
Sure, yeah. So our sort of key approach is we go and we sort of teach where the student is. So we don't go in and say you have to buy this software or endorse any kind of like huge IT overhaul. We go in, and the first thing that we do is a data and systems inventory. And we say, like, okay, what do you already have? And like most cities that we go into already have an Esri ELA where they have sort of end-to-end GIS software and resources. They typically have already invested in an open data platform that actually has pretty significant API capability, so you can suck data in from multiple systems. They have, some kind of SAP or big enterprise system that's doing a lot of their sort of mass data collection across many agencies. And so the first thing we do is we basically help them understand, like, you have all these data assets, you can start to sort of just usher them or shepherd them into one place. And so, and a lot of the work is just helping them do that. Now, when we start to go into the alignment of that data to outcomes and the analytics pieces, we oftentimes will essentially take a copy of that data and bring it into a JHU environment. And we have data sharing agreements that we deploy with the cities. And then we have a secure environment that we're housing that data in. And then our analysts are using our environment, but we're teaching the city how to create a similar environment and do the type of analytics that are required to sort of expedite their ability to hit those outcomes within our environment, in a way that's also teaching them to build it out and create the same kind of environment internally. Because our idea is that we're not trying to create a dependency on JHU. We want to be able to walk away and for them to be able to keep the work going in perpetuity. But oftentimes it requires us to be in the data very intimately. So we have some storage on campus that meets a lot of the security requirements that we know that government has to comply with. And we're using that internally. Now, we also have researchers that we partner with, and with the city's permission, we're often pairing research. And so we can use those same resources to bring data into the right environment. But because we play this intermediary role, we make sure that the city also is getting the most out of that research. And it's not a sort of data ATM for the researchers to come in and take the data, but that they're actually working in connection with a problem that is actually going to be solved in the city.
And does money change hands anywhere?
So Bloomberg, for the most part, pays for everything, the philanthropies. We have a smaller set of cities who have received some of the sort of free services that Bloomberg funds, and said, we want more and we want to partner with you. And so they're paying directly into the centers. We also now have funding from the Gates Foundation, from the Ballmer Foundation, from the Knight Foundation. So we have a much larger footprint, and so we're working with Pew is funding it for the states. We've got now a much larger footprint, but our model is try to find a philanthropic partner who will pay for it, so government doesn't have to actually. All we want government to bring are data and people to the table that we can then nourish with those skills. And so there's not, so that finances don't become the barrier. But once they start to value it, they realize first of all, it's very cheap. Like our trainings are cheap and everything that we do is very cheap because it's heavily subsidized on the philanthropic side. And so we can keep the costs quite low. So they start buying into it. And so we do have cities that are buying subscriptions into training and governments. And then now we have a whole set of nonprofit partners that are trying to also leverage the expertise.
We have an online question, and then we'll be right back.
Yeah.
So this question came in from one of our faculty members, Holly Wilcox. Holly asks, the major obstacles we face in using data for action in suicide prevention involves limited data access, the time expended for data use agreements and IRB approval, and being able to finance having a HIPAA-protected agency link various data sources and give it back to us in a de-identified way. This is not financially feasible, efficient, or sustainable. So how can we improve this situation?
Yeah, so, we've been able to figure out how to create kind of this independent resource. And it's allowed us to have kind of a blanket data sharing agreement with a city. And so a lot of our researchers have used the vehicle as a way to be able to take advantage of reducing the cost for them on the data side. I think it's a work in progress that we should certainly talk about, because I think that there's a huge opportunity, particularly if you have a researcher who's really interested in taking research and going to and through implementation. There's a real incentive for us to help. And we have been able to successfully create some of these environments within the government itself and do the assistance on de-identification and compliance before the data ever leaves the city environment. We've done it within the JHU environment in our sort of compliant data storage, and then been able to help researchers sort of reduce the friction of extracting that data. But I think that, this is an area that we're openly exploring with a lot of the university-led partnerships that we're engaged in, and we should talk more about it.
Thanks. Yeah, I'm Mary Jennings. I'm on the faculty here as well, and I just had a question. What projects have you had recently with the city of Baltimore and with the state health department in particular? Have they tapped into you, and are you helping them open their data to drive action?
So the state, believe it or not, does not want to partner with me as much as I would like to partner with them. And that's, I think, a political decision. But in terms of the city, I have actually a pretty significant investment in the center just for Baltimore. And so the three sort of key projects that we're working on with the city of Baltimore, one is kind of rethinking CityStat and where it is now. So we had the ability to bring in resources, actually quite effectively, to bring an I team. So we have an innovation team now that's being led out of the city at the city hall level. And Cheryl Goldstein, who's a colleague of ours, is now overseeing kind of all of the performance and analytics work. And she's got a guy by the name of Dan Heimowitz who's sitting on top of this sort of data strategy work that we're doing. And so the I team is actually for the first time, we've got a designer and we've got user-centered folks, and we've got data folks that are in thinking, and they're working a lot on the police side. And so we're helping them on police recruitment and the work that Harrison's doing to kind of really reshape the police department. But then on the other side of it, the Clean Stat program, which is actually the next big initiative that the mayor is really focused on, we're lending a lot of analytic support to the work that's happening across many agencies to deliver on the clean stuff. So working with the public works agencies, working with the housing agencies, working with CityStat and the I team, and figuring out and how they're doing that. And then the third big project that we're working on with the city is a project on race and equity. And there's a real desire to do some systems reengineering within the city to make sure that the systems are not creating inputs that are deeply biased. We've done a lot of work understanding 311 and who uses 311, and it's typically not poor Black people that live in the city. And so what we're trying to understand is how we can fix those flawed inputs. So number one, that services are evenly distributed and get to the most important places. And then how can we hardwire some of that in from a policy perspective to make sure that we don't further create big deltas in who's receiving services and who's not. And so that starts with an inventory, understanding where those flawed inputs are, understanding the dynamics of how that data is moving, how it's supporting decision making, and then going back and re-engineering those so that we can use more advanced analytics to actually improve outcomes for all people in the city. So that's a big project I'm really excited to be working on. The city is really leading that, which has been a real turning point under this new mayor. Yeah. Yep.
Actually, if you don't mind, I'm going to ask this question from our online audience because it's a good segue after what you just said. So the question is, do you develop or advocate for ethics guidelines on how cities use data? E.g., what's to stop a city from using better data skills and tools to weed out refugees or go after vulnerable populations, as an example?
Yeah. So again, like from a philosophical perspective, we're a do no harm organization. So we will refuse to work in places where they are not sort of on board. And what we know is that many systems are relying on old and bad and biased data, right? And so think about like almost every service decision-making tool, like Hansen or any of these big tools that government uses are basically driven out of property maps, and property maps can be deeply biased and flawed. And so unless you're willing to actually kind of head on think about changing what those inputs look like so that the outputs can deliver better result, we talk about that very upfront and transparently before we engage with any of our city partners. But for the most part, our network of cities is really interested. They understand that if they don't start to close these gaps, that they're going to have major issues, and that they're already seeing these major issues manifesting in their communities. And so there's a huge appetite to do this work. But we have released a few publications. So we have our first publication that has gotten a lot of traction is this AI resource that we produced. And basically the bottom line for us was you got to ask these questions and you have to be really deliberate about understanding your inputs before you start to engage in the utilization of artificial intelligence. We're about to publish a sort of follow-up to that. We did also a piece around algorithms and how algorithms, can produce really bad outcomes. So one of the things that we were asked to do is replicate this restaurant health inspection algorithm that a lot of cities were using. And it didn't take us but a little bit of time to realize that the algorithm itself was just producing violations in poor neighborhoods that were already really food insecure. And so we said, no, we're not going to help cities implement this unless the strategy is figuring out how to build the capacity in those communities and in those restaurants to make sure that they can stay open and that they can stay as part of a community so that food access issues aren't agitated by the use of the algorithm. And so these are the types of things that we're doing when we're looking at sort of the scope or the capacity of data.
It seems like success for a lot. Thank you. It seems like success for a lot of these programs or initiatives are based around a positive deviant gatekeeper who's willing to use data but also translate it into policies. Can you just speak to a little bit about how you're finding these people or how they're finding you?
Yeah. Oh, Rihanna's going to leave. Bye, Rihanna. Rihanna's doing some really cool work also. So if you don't know her, you should find her. So the kind of champions of the work itself are like the most important people. And so when we go in to do these initial kind of assessments, we have this very randomized invite list where, most of the time the mayor just wants to bring in the mayor's team, and we're saying, great, bring the mayor's team. But also we want people with these specific sort of skill sets, and we give them essentially like a profile. And usually when we have these first sort of assessment meetings, it's the first time that this specific group of people has been put in a room together. And usually in that group, we can identify like some real untapped resources. And we've been able to hone this over time. But oftentimes it is someone from the mayor's team where they hired, like in Jackson, Mississippi, they had this like comms person who was doing all of the comms work, and he like was this great analytic mind. So we put him through a series of trainings, and he became the chief analytics officer for the city in very short order. And he had originally been hired to do comms work, and we just realized like this guy's got what you need. He's got the skills, he can understand the dynamics of the problems, and he has a math brain that can solve some of these problems. And so we keep a keen eye on the skills. And then as part of the work that we're doing from the skills perspective in the skills marketplace, we're also surveying all of the students as they're taking our courses and doing a skills assessment. And so we're building a database of sort of where these skills exist in the public sector. And the idea is that we're able to now use that data to sort of figure out where these bright spots are and figure out how to connect them into leadership positions and get them sort of promoted within their organizations, like this woman in Memphis who now is the sort of de facto CDO of the city after doing this work. And the idea is like, we got to figure out where these people are, nourish them with as much skill as possible, and then talk about how impactful they can be, let them be impactful, and then try to get them and spin them into these leadership positions. And honestly, that's kind of how Josh and I grew up, and Tony also. We worked for a leader who invested in us. Martin O'Malley, I wasn't a political person. I was literally like a probation officer, just a few years before I was sort of the de facto chief operating officer for the state. And it was just about figuring out where the talent is and how to kind of give it as much as you can, and then it will actually deliver for you. And that's part of the model, which is like the professional development is probably one of the most important things that we're doing.
But more like, how are you finding those mayors that are willing to have that conversation?
Well, the benefit of being associated with the Bloomberg brand should not be underestimated. And so people really want to be associated with the philanthropies, with the work that they're doing. And Ballmer, Gates, and Knight also have a lot of credibility in the field. And so it isn't hard for us. We turn work away. It isn't hard for us, and a lot of it's because these are trusted brands essentially, and they're not trusted in the way that a Deloitte is trusted or a McKinsey is trusted because you pay a lot of money, so then all of a sudden you're going to get some value. It's more around the fact that these are being staffed, and these are initiatives that are being resourced by people who've actually had the practical experience. GovX is the name of one of our biggest centers in the centers, and GovX is, the Center for Government Excellence, but it's also because 90% of the people that work in GovX have worked in government. And so we are bringing that kind of experience with us when we're going in. And the idea isn't for us to bake a model and sort of shove it down the throats of government, but it's more to co-create within the governments themselves. And I think people are really attracted to these processes that acknowledge that they have skills and that they have a lot of value and that government can work. And it just needs a little bit of this kind of support to get it going. Yep, we're good. I'm getting thank you guys. This has been great. And so, my email was at the beginning of this presentation. And so if you want to talk to me, feel free to reach out. I'm going to get back to it. That's me.